Eileen Veilleux The Fam here. Welcome to the final installment in our mini mental health series on schizophrenia. In this episode, we are going to be going over the diagnosis and treatment of this disorder. So saying that, let's begin. Diagnosis of schizophrenia involves ruling out other mental health disorders in determining that symptoms are not due to substance abuse, medication, or a medical condition. Determining a diagnosis of schizophrenia may include a physical exam, which is done to help rule out other problems that could be causing symptoms and to check for any related complications. Tests and screenings. This will include tests that help rule out conditions with similar symptoms and screenings for alcohol and drugs. The doctor may also request imaging studies such as MRI or CT scan. And the reason for that, before we go on, as you can see, this is on the left, where it shows the normal brain. This is what a normal brain looks like. And this is what a brain looks like with somebody that has schizophrenia. As you can see, it is quite distorted. So that's why they may request an MRI, because an MRI would show this, or a CT scan. Psychiatric evaluation. A doctor or mental health professional checks mental status by observing appearance and demeanor and asking about thoughts, moods, delusions, hallucinations, substance abuse, and potential for violence or suicide. This also includes a discussion of family and personal history. The diagnostic criteria for schizophrenia is done by a doctor or mental health professional who may use the criteria in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, published by the American Psychiatric Association. And that's how they test for this. Now, there are treatments for it to help, and we're going to cover that next. So let's get into the treatment. Schizophrenia requires lifelong treatment. Even when symptoms have subsided, treatment with medications and Physio therapy can help manage the condition. In some cases, hospitalization may be needed. A psychiatrist experienced in treating schizophrenia usually guides treatment. The treatment team also may include a psychologist, social worker, psychiatric nurse, and possibly a case manager to coordinate care. The full team approach may be available in clinics with expertise in schizophrenia treatment. The medications available for schizophrenia are the cornerstone of schizophrenia treatments, and antipsychotic medications are the most commonly prescribed drugs. They're thought to control symptoms by affecting the brain neurotransmitter dopamine. Okay? The goal of treatment with antipsychotic medications is to effectively manage signs and symptoms at the lowest possible dose. The psychiatrist may try different drugs, different doses, or combinations over time to achieve the desired result. Other medications may also help, such as antidepressants or anti-anxiety drugs. It can take several weeks, though, to notice an improvement in symptoms. Because medications for schizophrenia can cause serious side effects, people with schizophrenia may be reluctant to take them. Willingness to cooperate with treatment may affect drug choice. For example, someone who is resistant to taking medication consistently may need to be given injections instead of taking a pill. Ask your doctor about the benefits and side effects of any medication that's prescribed, though. Also, second generation antipsychotics are available. These newer second generation medications are generally preferred because they pose a lower risk of serious side effects than the first generation antipsychotics. Second generation antipsychotics includes Abilify, Sapras, Rioxy, Vraylar, Clorazil, Benepat, Latuda, Zyprexa, Invega, Sorquil, Risperdal, and Geodon. The first generation antipsychotics, which have frequent and potentially significant neurological side effects, and include the possibility of developing a movement disorder that may or may not be reversible, may include chlorpromazine, fluphenazine, haloperidol, propenazine. Those there are what they call the first generations, and people prefer the second generations over the first ones because the side effects aren't as bad. The first generation antipsychotics are often cheaper, though, than the second generation antipsychotics, especially the generic versions, which can be an important consideration when long-term treatment is necessary. The physiosocial interventions. Once psychosis recedes, in addition to continuing on medication, psychological and social interventions are important. These may include individual therapy, where a psychotherapist may help to normalize thought patterns. Also, learning to cope with stress and identify early warning signs of relapse can help people with schizophrenia manage their illness. Social skills training, which focuses on improving communication and social interactions, and improving the ability to participate in daily activities. Family therapy, which provides support and education to families dealing with schizophrenia. Vocational rehabilitation and supported employment. This focuses on helping people with schizophrenia prepare for and find and keep jobs. Most individuals with schizophrenia require some form of daily living support. Many communities have programs to help people with schizophrenia with jobs, housing, self-help groups, and crisis situations. A case manager or someone on the treatment team can help find resources with appropriate treatment. Most people with schizophrenia can manage their illness. And then we have the hospitalization for the more severe. During crisis periods of times of severe symptoms, hospitalization may be necessary to ensure safety, proper nutrition, adequate sleep, and basic hygiene to them individuals. They also have electroconvulsive therapy. This is only for adults with schizophrenia who do not respond to drug therapy. Better known as an ECT, it can be considered. ECTs may be helpful for people who also have depression. The coping and support that's needed for people with schizophrenia. Coping with the mental disorder as serious as schizophrenia can be challenging for both the person that has the condition and the family and friends of the person. So here are some ways to cope with it. Learn about schizophrenia, and this is what the basic